So it's widely acknowledged that there are gender-based differences, what we would say are inequalities in health, in life expectancy, but also prevalence of diseases and conditions, the number of years that people spend in good health, and access to healthcare and health behaviours. And some of those things are due to genetic or biological factors, but in the main, they are due to the socially constructed roles of different genders and the relationships between them under capitalism. So the unequal power relationships between men and women, the social norms that decrease education and paid employment opportunities, and the tendency for there to be a focus primarily on women's reproductive role when considering healthcare, and also the lack of taking account of experience of sexual and emotional violence. Things like the likelihood of living in poverty and being economically dependent on men, intimate partner violence, discrimination, and a lack of autonomy in decision-making about sexual and reproductive health are just some of the issues that adversely affect women's health. So women live longer than men, in this country anyway, but women spend far fewer years in good health. So you know, things like the gender pay and pensions gap, which puts older women particularly at risk of poverty and of social exclusion, then creates a barrier to them being able to access healthcare and get what they need, but also means they're more likely to suffer a variety of different conditions as they age, and to not have such good health throughout their lifetimes. Women are much less likely to have their pain treated, for example, or their symptoms taken seriously. They are less likely to receive a diagnosis when they go to see a healthcare professional than men. And when it comes to conditions which primarily affect women, then they tend to be less studied in clinical trials and less money spent on research into these conditions. So one example is the example of a condition called endometriosis. I'm not going to go into details about what it is. I think a lot of people will probably know, but I'm happy to explain later if anyone wants an explanation. But it affects 176 million people globally. I think that's probably a massive underestimate, actually, because it's probably hugely underdiagnosed. But that, you know, it's thought to affect 1 in 10 women of reproductive age, and yet only £4.7 million of funding each year is spent on research into this and treatment into this condition. If you compare that to sleep research, where 50 times that amount of money is spent funding that research, it just gives you a bit of an idea. That's just one example. And of course, capitalism denies women the ability to have control over their bodies, and in particular when it comes to reproductive rights. So shockingly, I hadn't realized this until I did the research around this, then sterilization is still the commonest form of contraception globally. And some comrades will know some countries aggressively pursue sterilization as a means of population control, and often implement that without any consent and without offering women any other alternative, despite the fact that it's a significantly more risky procedure than vasectomy, male sterilization, but also far more risky than obviously reversible forms of contraception. And, you know, no doubt people will say, well, these are underdeveloped authoritarian countries that are implementing these kinds of things. But even when it comes to something as basic as the combined contraceptive pill commonly used in this country, then for decades, we've been told as women to take the pill for 3 weeks and then have a break for a week and have a bleed, and then take it again for 3 weeks and then have a break for a week. In actual fact, that is completely unnecessary. And the reason that that regime for pill taking was developed was the pharmacological industry's hope of placating the Catholic Church by mimicking what was considered to be women's natural menstrual cycle, in the hope that that would be an acceptable form of contraception to them. Of course, it still wasn't, but that has carried on, and there is actually no need for women to bleed. And in fact, taking it that way makes women far more prone to getting pregnant, because a lot of women will ovulate in that 7-day break, and therefore get pregnant when they don't want to. And so, another example of the way that sort of capitalism, capitalist society is dictating these things to women without them even really being fully aware of that, or why it's happening. And even when it comes to the treatment of men and women for the same conditions, then women will fare less well often. So in Scandinavia's held up as an example of brilliant social democracy and something, sort of the sort of country to be aspired to by some. But in Sweden, then women with psoriasis found it far more difficult to get treatment for that condition. And men were generally offered far more intensive treatments than women. So they would easily get access to things like ultraviolet light therapies, which weren't offered to women with the same severity of condition. And there are plenty of examples similar to that. On a global level, then TB has been described as a disease of poverty. The majority of the world's poor are women, but 2/3 of all TB cases globally are men. And in the past, that was assumed to be due to biological, sex-based immunological differences, and the fact that men have more social contacts, often in the countries that are particularly affected than women. But it's recently been understood that basically that is due to an underdiagnosis and underreporting of female TB, and the fact that women really find it much, much more difficult to gain access to TB services. In particular, that TB is stigmatized, that having TB has significant social repercussions for women, which are much different for men. So they risk divorce, they risk being ostracized by their communities. And understandably, women are therefore extremely reluctant to seek any help for treatment, or to even, admit to having symptoms that would suggest that they have this condition in many parts of the world. And that kind of highlights as well a problem in terms of the makeup of healthcare workers. So the fact that the higher grades of healthcare workers, the doctors particularly of consultant grade, and the higher grades will be dominated by men. And there's a lot of research that good interpersonal relationships between patients and healthcare professionals have, so things like mutual respect, openness, shared decision making about treatment and things like that, that in itself doesn't matter what treatment is given, but just the quality of that interaction has a therapeutic effect. Now, I'm not saying that all women healthcare professionals are great and all men are rubbish, but it is the case that women often describe their experiences as patients as being marginalized. They're often abusive, that it mirrors the power and status divisions in wider society. And of course, all of that is compounded by other factors like poverty, age, race, language, sexual orientation, disability, and so on. And women feel that they are far more likely to be judged negatively. And in fact, that is true, that they are far more likely, for example, to be judged as having psychosomatic problems and described by healthcare professionals as being demanding and emotional when they go for help with their symptoms. But it's also the case that there's research to show that women doctors are more active in asking psychosocial questions. They have more what are called partnership behaviours, so they're more likely to, rather than just saying to a woman, you're going to have this treatment and that's that, they will sort of discuss it and share a decision about what the best treatment is. And on average, consultations are 2 minutes longer with a female healthcare professional than a male. And given the choice, most women would choose a female doctor. And so there's a problem there, because there's this gendered division of labour, with women often being in jobs which are poorer salaries, poorer working conditions, and likely to feel disempowered and underappreciated in the roles that they play in their work in healthcare as well. And the other problem is, of course, the profit motive under capitalism. So there are huge financial incentives, whilst, the stereotypes, like we've talked about, the stereotypes of women often lead to women with pain being diagnosed as having psychosomatic problems. There can also be a financial pressure for over-medicalisation and sometimes invasive, excessive and inappropriate medical treatments where they're not actually necessary. And that will reflect the power dynamic that exists under capitalism. So there's studies that show that health workers will, in some cases, induce early labour, perform caesarean sections where they're not necessary on women in labour, so that the timing of the delivery doesn't interfere with their social and work schedules. And also, when it comes to treatment for fertility problems, then there are recently a massive range of treatments that women are being offered where there is no real medical evidence that they make any difference to the outcome, but of course will cost a lot more. Women and couples in a very vulnerable situation, desperate to have a child, often are being put under pressure to use these extended programs for fertility treatments, which aren't necessary at all and have no evidence. And in some cases, then there's been the use as well of harmful and substandard materials on women. The example of vaginal mesh being used to treat urinary problems in women, the PIP, breast implant scandal, and numerous others. I'm going to let other comrades talk about that, because I know there are comrades here that will be able to. And women that are come from oppressed groups, other oppressed groups like BAME women, trans women, gender non-conforming people, and women from deprived areas will often avoid health workers because of this fear of judgment, a mistrust really of the healthcare profession. They particularly avoid seeking help for things like STIs, contraception and abortion, because they fear being judged. And these gender dynamics under capitalism fundamentally affect communication. They fundamentally affect the way that people describe pain. They affect that quality of interaction, which has an impact on people's understanding of their diagnosis, the treatment that they're going to get, and their belief in whether that treatment is correct for them. And women often repeatedly describe feeling really unable to ask questions when they go and see health professionals. And of course, some of the answers to all of this are to do with time and resources. So, health workers that are stretched to the limit because of cuts and because of privatization to services are going to be less inclined to delve into discussing details of somebody's life beyond the basics of their symptoms. They're not going to ask about how that's impacting on their work or how their work might be impacting. They're not going to ask about what their relationships at home are like and things like that. And yet it's been shown that women who are experiencing domestic abuse tend to attend for more appointments with healthcare professionals, tend to often have a wide range of different medically unexplained symptoms, and yet rarely do healthcare professionals ask the question, are you a victim of domestic abuse? So, these things are down to resources and time a lot of the time, and also an understanding and a training that doesn't happen routinely in society for healthcare workers. So it's clear that we have to fight for those resources. I think we have to fight for specific women-centered services as well. But it's vital that we break the profits motive for providing healthcare that exists at the moment. So there has to be a reversal of privatization that's taken place. There has to be more investment in research into the conditions that primarily affect women as well, to an equal extent. To a greater extent, all levels of research need to be expanded on, but in particular, those that have previously been neglected on the basis of gender. There needs to be greater training. So, ideally, healthcare workers need to be representative of the populations that they serve, the women and men, and the whole community that they serve. But of course, that is something that's going to take time to address. But in the meantime, there should be much greater training for healthcare workers on all of these issues. Time and time again, you see male GPs not having a clue how to treat women who have menopausal symptoms, for example, how to discuss issues of contraception and so on, or even really having a clue how to do a pelvic examination. But in particular, then, of course, there has to be democracy in the way that healthcare is provided. And the only way that that can happen is by the system being completely transformed. Women have to be involved in planning the services that they use. But across the whole of society, then we have to be involved in planning our healthcare systems in a democratic way under workers' control. And that requires a change in the system, the way that the systems run, the transformation of society into one that doesn't make profit the motive, makes the needs of the population the motive, and improves the health of everyone. That is socialism.